Are you looking for ways to heal from childhood trauma? Do you want to understand and process your experiences in a safe and healthy way? If so, then this video is for you. We'll provide an overview of the healing process, discuss education resources, and provide actionable steps that can help you move forward. Recognize the trauma. It is important to be patient when dealing with childhood trauma and its aftermath. There is no single, correct timeline for healing and recovery, as each child will progress at their own pace. It is important to be supportive and understanding during this process. By using psychoeducation to raise awareness of the connection between thoughts and emotions, you can help your child reclaim control. Additionally, it can be helpful to recognize the signs of toxic stress and trauma, such as depression, anxiety, panic attacks, and difficulty with learning. Once the trauma has been identified and acknowledged, it's important to sit with your emotions and their sensations. Letting the feelings percolate and flow, without attempting to change or hide them, is vital to the healing process. This helps you become more aware of the inner child, unearthing the pain and ultimately offering a path to healing. To do this, try meditation to practice acknowledging and sitting with any feelings that come up in your life. Additionally, self-compassion techniques like the butterfly hug and writing letters to your younger self can help work through painful memories. Play therapy is a beneficial form of psychotherapy that uses play to help children process their emotions and mental health issues. By utilizing play as the primary medium, play therapy taps into the healing process to help children who are suffering from PTSD or trauma. With the guidance of a trained professional, nature-based play therapy incorporates the child's relationship with nature into the therapeutic process. Additionally, this type of therapy helps increase awareness of the connection between thoughts and feelings, as well as recognizing triggers and identifying appropriate coping skills. The recovery environment is of particular importance, as it provides a safe space for children in crisis to heal and grow. With patience, knowledge, and understanding, childhood trauma can be effectively managed. Learning to calm your mind is a key step in the healing process. Through relaxation techniques, such as meditation, mindful self-awareness, self-compassion exercises, and the butterfly hug, you can start to break the cycle of negative thinking that often comes with trauma. Additionally, it's important to give yourself time and be patient with the healing process, as every child heals differently. With therapy and extra support and understanding, kids can learn how to manage their emotions and regain control of their environment. It is also essential to recognize and understand your child's triggers in order to better support their healing journey. Prolonged exposure therapy is a subtype of cognitive behavioral therapy used to treat PTSD and other mental health conditions. Sessions may take place over 3 to 10 months, depending on the individual's needs. During this type of therapy, patients are taught to gradually approach the traumatic memories and feelings associated with the trauma. With the help of a qualified behavioral health professional, individuals can learn to process these memories and develop coping skills for managing their responses to trauma. Patients are also encouraged to focus on the present, rather than dwelling on the past. Be patient and understanding with yourself during the healing process. Everyone responds to trauma differently, and it takes time to heal and recover. If you find that your recovery is taking longer than expected, it's important to be patient with yourself and remember that healing from childhood trauma is a process. Seek support from a qualified behavioral health professional if needed, and don't be afraid to ask for help if needed. Treatment for childhood trauma can include cognitive processing therapy, CPT, cognitive behavioral therapy, CBT, and prolonged exposure therapy, PE. It is important to remember that there is no one-size-fits-all approach to healing from childhood trauma, and that it is not a quick process. Every individual has different needs when it comes to recovery, so working with a qualified behavioral health professional is essential. Additionally, patient education is key in understanding how to properly heal from childhood trauma. With the right treatment and guidance, healing from childhood trauma can be achieved. After recognizing the trauma, sitting with their emotions, playing therapy, and learning to calm their mind, it is time to consult with a qualified behavioral health professional. These professionals are trained to help those dealing with trauma and can provide evidence-based treatments such as trauma-focused cognitive behavioral therapy, eye movement desensitization and reprocessing, EMDR, and prolonged exposure, PE. They can also provide support for families and individuals affected by childhood trauma. In addition, many organizations offer grants and other funding for treatment services, such as SAMHSA's Jail Diversion Trauma Recovery Grant Program, Children's Mental Health Initiative, Women, Children and Family Substance Abuse Program. It is important for individuals to remember that healing from childhood trauma is a process that takes time and patience, but with the right support it is possible. Patient education is an essential part of healing from childhood trauma. It helps individuals understand their trauma, sit with their emotions, learn calming techniques, and engage in therapies like prolonged exposure therapy and trauma-focused cognitive behavioral therapy. It is important to be patient and consult with a qualified behavioral health professional to ensure the best chances of success. With love, support, and a commitment to self-growth, individuals can heal from childhood trauma and create a brighter future.